taking a moment out of your day to explore an initiative that I've been working on for a couple of months now. Um, this, I will go into this, but it did start off as a conversation that Arns had cultivated through a presentation that he shared around some of the opportunities that AI may present to our field within mental health and in particular peer work. This conversation really sparked a lot of curiosity and illustrated to me that there was this moment is really ripe for a conversation, a deeper dive to understand something about how people are experiencing AI and also how they understand change at this particular point in time. So I'm going to go in and just touch upon some of the themes. Now, I've put together a report and also an insights and possibilities companion piece, which allows us to understand a little bit more about the very unique argument or um, perspective that 6 peers that I've worked with through this research have presented, and they're all compelling in their own way and certainly suggest that everybody brings such a multifaceted lens. And I'm really delighted that I met with 6 people that had something very unique to offer. So just jumping into this probably will take about 15 to 20 minutes, and then you've got the opportunity to reflect upon the report, which has a lot more information that you can, digest in a way that works best for you. So in terms of, as I've mentioned, the research background was sparked by Anne's, my wonderful colleague and family and carer peer worker. It really indicated through that conversation that there was a real curiosity, a sense of experimentation in how people are using it in their home life. And also, a way that people may have a bit of hesitation or then unsure about the way that this tool might be able to be applied in many different ways. They are either in how they're communicating or how they're researching or how they might be using it in their home life or in other capacities. So I aim to bring those sort of those water cooler conversations, or those conversations that are happening, in that particular space, into a format that meant that we could do something with it. We could use it as a basis for understanding where we're at, how we're feeling collectively, and how our different perspectives we might be able to help one another. So I wanted to create unity, a shared language, and common ground to help steward a conversation forward. Originally, I had anticipated speaking to all of our team, so it wouldn't necessarily just be a peer perspective. It would be also clinical, have our clinicians as well. However, we pivoted this work and focused on 6 specific peers, which has offered another opportunity to really zoom in and have a look at those distinct insights and strengths to explore, in quite a different and nuanced way. So, and just to give everybody a little bit more of an opportunity to expand upon their thinking and their ideas through the Insights and Possibilities companion, which you can have a look at as well. So why this work? Look, I think one of the interesting conversations that's come up time and time again while talking about this work is that there's been a misconception that this is an AI advocacy piece, meaning that I'm promoting AI, but in fact, it's not. This is agnostic. This particular piece of research, I'm very curious about. It feels that it's inevitable that AI is coming our way, and I'm really curious about how people feel about that and what they understand about that and what they think is necessary because this change is coming. So I'm interested to know, how do people understand the shaping of that change? And so I've gone through a number of different questions that looks at that from a few different perspectives. How do we tend to disruption with the same care we offer those we support? So we know that we're, often reminding people of the agency that they have, of how they can exercise their decision making, and how, given the sort of turbulence of the people that we meet with, how they might practice a type of resilience in that. And so there is a very similar thread running through this work. It's absolutely grounded in mutuality, in the idea of that we have very different worldviews, and sitting in spaces where we can have conversations about our differences is so important in times of change, connection, and moving towards. So this idea that we are moving, we're absolutely, this is heading our way, but how would we like to move towards this? In what do we need to support ourselves? What do we need to support others that we're working with and as a team? So, this sounds like a very tech loaded topic, this AI project, but it's really about humanity. So how do we bring humanity into the center of this conversation about technological change, and create a space for discomfort and possibly and the possibility that can come of this particular moment? My goal was to really honor the real voices and perspectives of people in the team and extend insights to support policy development, because this is absolutely going on in the background. And whatever we can do to amplify the unique work that we do, the nuts and bolts of what we do, and how that will interface with AI will be different than other people. So, getting ahead of the conversation just to make sure that we're amplifying our own individual, collective, day-to-day activities is only going to help our team. So, in terms of the way that I went about this, so I approached this as a quantitative, meaning rather than looking at numbers, qualitative. Quantitative is about the quality. So I was really interested in how people felt and thought about things. I had 29 questions across 5 focus areas that I felt were particularly important to our operational day-to-day, and how we would be ultimately impacted, or what we would need. So that was training and learning, policy considerations, practical applications, ethical considerations and risk, and workplace culture. Obviously, there is some crossover in all of this, which it is always part. Nothing happens in very strict binary categories. So there were 6 long form interviews, approximately 60 to 80 minutes each. And I did a bit of a thematic analysis, just having a look at some of the different themes that were present in each of these categories. As I mentioned, there are a couple of companion resources, a full report, and insights and possibilities guide. So the thematic areas that I looked at, as mentioned, were the practical applications, and that meant things like how might peer workers already be using AI. And obviously we had a moment where there wasn't a clear directive around the use of AI, and so people in different ways were using this in a small degree at work. So learning a little bit about how that supported them in a day-to-day sense, and what kind of tasks and interactions might be supported or enhanced moving forward. So there's that real sense of like looking back, perhaps if there was some experimentation, and also what they might try once that we've navigated this change around policy and culture. So how might the integration of AI shape how we connect, collaborate, or build trust? And what might shift in the way that we learn from each other and work as a team? Training and learning, what kinds of support, learning, or scaffolding might peers need to feel confident and competent with AI? And what does meaningful training look like in this context? What would it actually, how would it be different, if at all, to the sorts of training activities that might be available to us already? Ethical considerations and risk. What risks or ethical questions arise when using AI in peer contexts? How do we honour the values of peer work while engaging with new tools? And finally, policy considerations. What should policy and policymakers take into account to support our unique peer work? How do we ensure guidelines reflect the unique dynamics and sensitivities of our very specific work? So just cutting straight into the responses. Now, this is a very high level, and this was really just around what came up more often. The opportunities that people saw, generally speaking, time and time again, was that AI would overall reduce admin burdens. And that would mean more time with carers. And that would mean more time to do meaningful activities that was either benefited the community or benefited our team or benefited the worker by doing more meaningful work. So it can help carers navigate systems. And so, all of the navigating of various, whether it's tax, whether it's the law, whether it's Centrelink, is a time consuming process. And if there was the possibility of supporting the utilization of that tool, there could be massive benefits. The boosting of creativity and idea generation was a very big theme. Supporting inclusion and accessibility of people that might need some scaffolding or might need some way of supporting them to deliver, to undertake the work that they're doing on a day-to-day basis, and particularly, perhaps repetitive work or work that requires a bit of a gear change periodically. So concerns was that the bias in the output, that it's not always nuanced, the response that people receive from AI. It doesn't bring our unique lenses. And so that was a concern. The lack of transparency, meaning if we are using it, it appears that there's no disclaimer that comes with an email that's been written by AI, or whether we're using that to make sense of data. So there was a sort of bit of a question around that. The potential for warmth and authenticity was another theme that came up, and the de-skilling of over-reliance. That means once we get AI doing our day-to-day work, at what point do we start to see, those skills dwindle? If we, whether it is the email writing or if it is the problem solving, there was a real caution around becoming overly dependent upon AI. So here I'll just jump into some of the more in-depth responses. And again, I would recommend reading the report to have each of these points really qualified with further information. But the responses, now you can see some of the quotes just down the side, Parvin and Anne's, that have bring their own perspective to this particular theme. These quotes are taken from our interviews, which were recorded. So training and learning, the key insights were it's more than tech skills, actually. So when we're learning about AI, there are some really ethical questions that are raised. And so whoever runs these sessions must be able to, facilitate those more complex questions about, humans in the workplace dealing with other humans and AI, and how to navigate this emerging, philosophical quandary that we find ourselves in. So practice-based, meaning hands-on, was important, not theoretical, not stand and deliver, but something that's very tactile was important. That it's role-specific. So there was a bit of caution around this idea that there's a one-stop shop training. And in fact, we're all doing different things, from the GPs to the peer workers. And so that means that we, the way that we adapt our tool to what it is that we're doing in our role must be, will have to be different. And that means the way that we learn about it or talk about it will be different. So another point that came up is that, that everybody has different starting points, and that might be around competence or familiarity, but it might also be around how people feel about, this new tool from a, whether it is from that ethics or moral perspective, or whether it's from a, an overall perspective around the role that technology should or could play in our life. So there's a real sensitivity around, as with the first point, just thinking about the emotional aspect of this as well, of this change, and consider applications for neurodivergent staff. So there appear to be so many ways in which we can use these tools, and there are some ways that can keep people, employed in a way that allows them to feel supported. And so to be curious about what that might look like. Policy considerations, policies. So one point was that it needs to evolve. AI is evolving radically, in a rapid way, and so obviously there needs to be an adaptive quality. The idea that one size fits all again was it was important to people because again our roles are so different. So if it looks really great, if policy looks like it's a true fit in one area, it might actually really constrain another area. So being really aware of how our interactions with the public or our interactions with information might be extremely different, and we might have unique functions within one team, and so that's important to be known. Transparency in use was very important. If we are to filter data from the public through this AI, through AI processes, that it is known and that there is consent. So this is something people had different perspectives on this. We're already using a number of different pieces of software that always have some type of risk. So this is an interesting one to explore as well in terms of how we communicate that. A desire for co-creation. So this idea that we can filter information around our uses in the development of policy. There was a curiosity around what other people are doing. At this stage, there didn't appear to be much familiarity with what other healthcare organisations were doing. And there was a sort of some caution around the idea that sometimes, again, the one size fits all can really stifle innovation and finding new ways to work. Practical applications, as mentioned before, the reduction of admin burdens is pretty much the number one, mentioned thing by all the peer workers I met with. It can support with communication, and there's infinite numbers of applications that were brought, and I would really recommend looking at the other resources to learn more about this, particularly the Insight and Possibilities Companion. Idea generation was a huge one, really breaking that idea of the blank page, the tyranny of the blank page or the blank canvas. People really felt like they could get something off the ground quite quickly with AI, and then they could bring themselves and others into the conversation, and that really helped with collaboration. So potential in carer support, as mentioned earlier, and the feeling of getting unstuck. As you can see, Tamsin's mentioned, I asked it to help me design a flyer. I still wanted it to sound like me, but it gave me a good starting point. And Parvin, if a carer needed help writing to Centrelink, I could use AI to draft something quickly with them. So ethical risks, again, you'll see a bit of duplication here. Transparency is key. Privacy and consent was questioned. AI as a support, not as a replacement. And warmth and trust must be protected. So those very human qualities that make our work so special, that we've really fought for as a workforce, so that they are not, that AI doesn't shift into that space and change the way the service that we deliver and the connections that we forge. And a risk of bias and inclusion. Sometimes AI can generate information that takes a particular cultural position on things, or is not necessarily aware of, cultural or social issues in the way that we might be, or the way that more formal research might be. And so leaning too heavily on AI as a one-stop shop problem solver and data processing system seemed risky to some of our peers. Culture, this was an interesting area. So every program service is different, and so it will probably impact the way that we work differently. Relational habits matter, and that might mean the fact that when I have a question and I turn to my colleague, that creates a type of collaboration and a cohesion in the team. If that stops happening, a concern was, well, how will we feel interconnected? If every time I find a superior problem solver in AI, what will that mean for a sense of community at work? So the idea that the reason that we get together often is to exchange information. If we don't need to exchange information so often because we can find more efficient ways to make sense of that information or to translate that information or to process it, then, will we still, what will meetings look like? And perhaps there are other possibilities there, but that was one that was sort of a bit of a question mark for people. The idea of siloed use, and that means we can move so quickly with AI that suddenly we can, progress a particular idea or progress an area of work that may mean that we will increase the distance between workers and where their, I guess, where their focus is at. So that's an interesting nuanced one. And workload questions emerge, like if we're able to do our work so much faster than we used to be, which there's lots of statistics around that estimate what this will look like for our workforce. What does this mean for us at work? So that's an interesting one to consider. So in terms of looking ahead, this initiative is now coming to a close in this particular format. But other ways to progress this conversation could include surveys and further conversations, dialogue, and low pressure prototyping. So you'll see that I have some how might we's, which is a really interesting way to take a notion into something that has some form and function. So you can sort of develop something in a low risk way. Embedded reflection. So really just starting to cultivate conversations around AI and what it means and what people are discovering and, who they're talking to in the sector. So just creating an ongoing conversation that helps people come together around this theme. And build collective capacity. So that would be, once we do have an AI policy in place, just around considering how we share information across program areas, how we continue to bring different perspectives in around the application of AI. So, just in closing, I just really like to first of all acknowledge Arns for starting the conversation and for, I felt so excited by that conversation that it really brought me into doing this work, just to learn more. I just really was interested in continuing that particular line of thinking and see where it went. So thank you, Arns. You've been wonderful in exploring this throughout the process and the contributions that you made during your interview and the wonderful notes that you put together. Just is such a demonstration of your collegiality and your passion and your drive for learning and continuous improvement. So I thank you. Parvin, Chloe, Arns again, Kath P, Tamsin and Joshua. I was just so delighted and impressed by your ideas, your creativity and your insights and how much you really sort of came alive when sharing them so generously. So the leadership team, I really wanted to thank you for supporting this work. And for anybody not part of this work, there are so many stories and questions and ideas that are yet to be sort of put together in a slide deck like this. So this is just the beginning of a starting point that can be you can continue to build on this. And maybe you see things that others don't, and maybe you agree with things or disagree. And that's a really, a opportunity for some more generative sorts of conversations around the future, around change, around AI. And if you're interested in learning more, please take a look at the Insights from Lived Experience Research Project report, and also the Insights and Possibilities guide or companion piece. So thank you so much for taking this time in your day. And I look forward to, chatting further with you all about your sort of thoughts and feelings and takeaways from this.